We're delighted to be involved. I'm going to talk to you briefly about a project that we've been running nationally that is looking at a grassroots approach to self-care, and it's building on the social capital of patient participation groups that already exist within general practice as a way of engaging and empowering patients to actually take steps themselves to look after themselves when they have minor ailments. So this is very much an approach which is balancing with and complementary to the professional clinical approach that we have from our GPs in general practice. So we ran two little workshops, one in Manchester, very much with the support of our colleagues, and Sue Summers is here today, from NHS North West. We ran that in collaboration with NHS North West and their Choose Well campaign. And the Inner London workshop we ran was coordinated by a patient participation group at the Lawson practice, and Roger Till is here with us today, the PPG rep who set up that workshop for us as well.
Oh, it was quite a dramatic event. Lots of good input from patient participation groups, because being in an inner city area, there were representatives from quite a few different practices there. And they were very concerned that it should not be about going to the doctor less and saving money, but it should be very much about doing the right thing on the right occasions. So getting a good balance between looking after yourself and going to see the GP.
And gaining confidence too, to know when you need to go and consult, whether it be physically or whether it be by telephone or email, and whether you can do it yourself.
People in the workshops were telling us there were lots and lots of opportunities out there that we could build on, all sorts of things really. When new patients join a practice, self-care messages or talking about how people can take those kinds of steps could be part of their interview. Some PPGs have put together really helpful folders about some of the common ailments and minor illnesses that were kept in waiting rooms. There is so much potential, as the Minister mentioned, in the voluntary and community sector out there. Lots of very diverse ways that we can tap into people out in communities, particularly those who don't actually come to the practice as well. PPGs already, as I've mentioned, do drop-ins and information events, and virtual PPGs are now starting. We have the new requirement within the GMS contract for GP practices to develop more of a relationship with their patients by setting up a patient reference group. And that can also be a virtual group where we can have conversations and dialogue with patients via email networks.
It possibly also needs, considering the answers to some of the presentations, for us to approach accident and emergency departments and walk-in centres where people may be going, and I'm using may underlined in capital letters, inappropriately. So one can go there and attract people there, but it will be a long-term process. I mean, I have great belief that it will happen, but it's giving confidence to the public.
So we're going to run some more workshops. We will develop our work with our colleagues in the NHS North West around Choose Well, which is a very proactive campaign. And we're going to develop some very robust materials that can help PPGs to work with patients in their practices. And we'll capture all of that stuff. And if you'll have us back, we'll come and tell you what we found next year.